She is in the building. Commissioner Taylor?
Here.
Commissioner Spiz is absent with notice. Commissioner Powell is in the building. Commissioner Gingell?
Here.
Commissioner Lukes?
Here.
You have quorum.
Thank you. Please rise and join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes from July 8th, 2025. I have a motion by Commissioner Taylor and support from Commissioner Gershenson. Any comments on the minutes? All in favor of the minutes say aye.
Aye.
Opposed? Our minutes are approved. The next item is approving the agenda. Commissioner Taylor.
Yes, Madam Chair, I'd like to ask for the removal of item 12A, which is the use of law enforcement enhancements fund for the refurbishment of Air 2, only because this is a budget item and they're presenting to the budget tomorrow. And under their presentation, aviation is being taken up. So I'd like to remove this from this agenda today.
Thank you. For that, we need a second. So it will go to the Finance Committee tomorrow. It is common procedure for contracts to come before this committee. This is a budget amendment, so I'm open to everyone's pleasure.
And your support.
We have a support by Angela Powell. So we have a motion to remove 12A, use of law enforcement enhancement funds for the refurbishment of Air 2. This will go to Finance tomorrow. Are there any comments or questions regarding this item? Do you want to prompt the vote?
Three yeas, one nay.
All right. Item is removed and will go to Finance tomorrow.
I'm sorry? Oh, four yeas, one nay.
Thank you.
Thank you.
Okay, we have arrived at public comment. This is, oh, I'm sorry, did we approve the agenda as it's standing now? So I have a motion by Commissioner Taylor, support from Commissioner Powell. All in favor say aye.
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 Opposed? All right, our agenda is approved. Our first public comment of the day is for items on the agenda. Is there anyone from the public wishing to comment for items on the agenda? Then you would come to the head of the table and state your name and community, and you have 3 minutes.
Good morning, Commissioners. My name is Stephen Dronin with Lockwood Development, here to speak in support of item 10D. This is an affordable housing development my group has been working on in downtown Royal Oak. We've been working with the city for close to 2 years on this, and it's a really exciting affordable housing mixed income development that we're proposing to get out of the ground later this year. And I'll be here mostly to answer your questions if anything should come up, but I just want to thank you for your time and consideration of affordable housing in Royal Oak. Thank you.
Thank you. Anyone else for public comment? All right, public comment is closed. We move to our first presentation, which is regarding Hope Shelters. And is this Elizabeth? Is this you? All right, thank you. I'll get out of your way.
Good morning, everyone, and thank you so much for inviting me to come today to speak to you about Hope Shelters. Thank you so much. I also brought some brochures and some cards, so I'll leave them here. My name is Elizabeth Kelly. I'm the interim CEO of Hope Shelters. I was also the past CEO of Hope Shelters. Before that, I was the board chair of Hope Shelters. And then I led the task force that created Hope Shelters. So you're getting me talking about my very favorite thing in the whole wide world. And so I want to talk to you a little bit about the value that we bring to the Oakland County community as part of infrastructure. And there are 3 things that I'm going to circle back later. $17 a month, 528,000 households. And I forgot what the third one was, but we'll get to, $100,000. All right, so we're gonna talk about that in a few minutes. We're going on to the next slide. These are our buildings. We operate 2 low barrier shelters, and we'll talk about low barrier in just a minute. The one on the left, the one that has the big cross on it, even though we are a secular organization, we bought a church, and the rehab took place on the inside, not on the outside. But that is our emergency shelter located on Baldwin Avenue. And the brown building is our recuperative shelter, which is the discharge to home from the hospital. If you have no home to go to and you're in the hospital, that's a safe place for you to recover. Okay, so low barrier shelter. Those are the kinds of things. What we do is try to reduce any barrier that people will have that keeps them from moving forward with their lives. No sobriety or ID requirement. We were actually one of the first in the state to espouse that particular model, and the state actually followed suit with us. We don't do background checks. What we do is a come as you are. Guest mail, that comes to Hope, but it's also a guest that has moved to housing. If they don't have a safe mailbox, they can still have it there. People who are living rough in the community, it's a way for us to engage them and try to get them in shelter so that we can resolve shelter. And we are non-judgmental. We also support folks in the neighborhood. And so our goal is to make sure that people have what they need. Okay, and again, meeting people where we're at. So we operate 2 buildings, 365 days of the year, around the clock. We provide the neighborhood because we are located in the Baldwin neighborhood in a very distressed area of Pontiac. And so our goal is to prevent people from becoming homeless as well. And so we prevent them by providing them with bag lunches, so food is not an impediment, that they're not going homeless because they can't get food. We have the clothing for them. We even have guests that on bad days, especially when the weather first changes, that watches the bus stop right in front of our building. If we see people that are not clothed properly, they go out and they literally outfit them. It looks like one of those TV shows where they do the transformation. They'll match the scarf to the gloves and the hat and everything else. But we try to make sure people have what they need. And we bring services to the shelter. All medical services, mental health services. And during COVID, we were such a trusted entity among the population that we served, the homeless population, that we had between 95% and 100% vaccination rate in the shelter. We have public health nurses that come in all of the time, and those nurses do a really excellent job in making sure that they connect with people. So this I wanted to show you. Now, those are numbers of the regions where the continuum of care, how it's divided up in the state of Michigan. We're not ranked number 10, we're actually number 1. 28% of those that are homeless live or actually are in Macomb, Oakland, and Wayne counties. But you'll notice that in Region 9, Washtenaw is in there, and that's 11.8%. And the other purple one in Genesee County, which is all nearby, interconnected by buses. And homelessness means that you don't belong to any particular place. So people often are going from one shelter to another in order to make sure they get the care that they need. And then some context. Oakland County, we have about 185 shelter beds right now. That includes Haven for domestic violence, Lighthouse for families, and Hope for the singles. There's maybe an extra 50 beds in warming centers over the course of the winter. But on a single night in January, and somehow HUD manages to designate the very worst night of the year, that's the night you never want to plan anything. That is, we come up with somewhere between 400 and 600 people living rough. But those are the ones we see. I live in the north end of the county, and nobody is up there looking in the state lands because it's dangerous and it's dark, and so there are way more people than are being counted. But the ones that are being counted, we still don't have enough beds to serve. And then I have the HUD definition there, which is the official one. Oakland County homelessness by the numbers. So the latest numbers we have are 2023, but you'll notice that there's a small uptick. 2024, those numbers won't be released until December of '25. But we're being told that to expect an uptick now of as the COVID money has run out, to expect an uptick in homeless numbers of between 8 and 10%, which is pretty substantial. And when the economy sours, the homeless numbers also go up even more. So just to give you a little bit about cost effectiveness, the cost of one night in Oakland County Jail, according to the website, is about $105, but I'm sure it goes up from there depending on the other services and things that they need. Plus, that person is pulled out of society, they may lose their job. There are a whole lot of reasons why this, and this can make somebody less employable. If they go to the hospital because they're homeless, that's $3,000 plus. Walking into the emergency room, anything, if they say chest pain, they go through a whole series of things to help that particular individual. And squatters in blighted properties reduces property value by almost $8,000. Increased costs for other things like code enforcement and things like that, and then blight cleanup. Those are all expensive ways to have people homeless, and they certainly don't do anything to change that condition. So we're an efficient, low-cost pathway out of homelessness. Our emergency shelter night, somewhere around $50. Our recuperative shelter has a medical aspect to it, so about $75. But people are only in the shelter for about $2,500 to $3,500 worth of services, and then we discharge them. More than 50%, we're not a housing agency, more than 50% we are discharging into safe housing. The ones that don't discharge to safe housing, those are the people that are having problems being in a giant room with 62 beds. They don't like the flicker of the lights. They have all sorts of issues that prevent them from being able to stay comfortable and stay. We'll talk about that in a few minutes too, because we're working on a resolution for that. We connect people with identity documents. That's one of the things that's really hard. People, when they're homeless, they don't have identity documents, a state ID, birth certificate, social security card. I led the task force that created law change that Michigan now provides a fee-waived state ID and a fee-waived birth certificate if you're born in Michigan to those who are literally homeless. And that's because agencies like mine don't even have a line item for that. We're critical infrastructure. And this is something that is a really important thing to keep in mind. Soft infrastructure, like the art museum and the zoo, libraries, those kinds of things are really a part of who it is that we are as a community. But so is taking care of people who are most vulnerable. We do things like we provide essential services not only to the shelter, but to the community that we're in. We provide services to people after they leave our shelter, if they need to renew their Medicaid, or if they need to renew a Section 8 voucher and they can't navigate all of the forms that are responsible. We do that, we call that front door service navigation, because that's very impromptu, but our case managers will jump in. And we promote stability and reintegration. So on a different slide, it said that we had a recidivism rate of less than 5%. It's the best in the state. And that means after a year, 95% of the people that we got housing for are still housed. And they're still productive citizens. And by the way, about 20% of the people currently in the shelter are gainfully employed. They just don't have a job that pays them enough money to be able to rent an apartment in Oakland County. And as COVID proved, we improved public health. So there, I want to go into that one. So Hope is typical of shelters in Michigan, where we only have grants that make up about 50%, if we're lucky, of the cost of actually operating the shelter. In the past, we made up shortfalls with things like we had host groups that would come and provide dinners. We had all kinds of donations. A lot of faith communities supported us. All of these things are important. But that disappeared with COVID. We are struggling with trying to make sure that we are making up this shortfall. Other counties, Washtenaw, Ingham, and Kalamazoo counties in particular, now support their shelters. And they also add to so that the shelter, which is an important part of that infrastructure, is able to maintain what it is that we need. So I told you at the beginning of this, I said 17. So the $17 is what it costs per month per household, which is the 528,000, in order to give us an annual grant of about 900,000 that's going to get us through to be able to pay our folks a living wage. We are an employer and we need to pay our folks. I have staff that are on food stamps. They have college educations and they're on food stamps. That's not acceptable. And we struggle every day to try to make sure that we have what we need. A catastrophe is that if a furnace breaks and we have to pay $10,000, there's not $10,000 in the bank that we can do that with. And if a cost of leasing 2 pandas from China in the zoo is $1 million a year. And we're talking about people, and this will allow us to serve more people. And this is why we are in the process, thanks to the Home ARP, we are going to be able to build a new shelter, a shelter where we're gonna have individual rooms. So the people that are bothered by the flickering lights and the noise are going to be able to safely be part of the shelter and stay long enough in order to be able to get all of their vital docs, to be able to get connected with housing services, which our housing agencies are wonderful. They work with us. Our FQHC, Honor Health, wonderful. The health department, we have amazing partners that help create mental health partners. They all create services and a network for people in order to be able to help them be able to resolve their crises and then to be supported through this. And so we will be turning this into a facility that will have more than 100 beds. We will still keep our facility on Baldwin for overflow. Right now, we turn away about a dozen people a night, and this is the middle of summer. So in the wintertime, I do not know what will happen. A few warming centers are not going to pick up the slack. And warming centers are wonderful to keep people safe, but they're a Band-Aid. We bring services to people, we make sure that they get what it is that they need. And so I know I sailed through this really fast. And if you have any questions, my contact information is on here. I also would welcome you to come and take a tour of our facilities because you'll see how efficient we are, how every square inch is used, and how we serve every community in the county. Because people who live in Bloomfield Hills might not think that there's a problem with homelessness, but we have people in our shelter who have been living in Bloomfield Hills. We've had a Grammy winner, we've had doctors, we've had dentists, attorneys, accountants, and we've had people who didn't get out of the 3rd grade. Poverty is the biggest driver, and somehow people become disconnected with resources, and our goal is to help them get back together again. So thank you for your attention. Sorry, I talked like I was on helium, but I had a lot of things that I wanted to cover, and I appreciate your assistance. So I'm putting it out there that if you would consider being an investment partner in the services that we provide so that we can serve 1,000 or more people a year and make sure that they become connected with housing, with all the resources that they need, with employment, because when you are homeless, the chaos of homelessness is sometimes very difficult to maintain a job. So thank you for your attention.
Elizabeth, where is your new building going to be?
It's going to be just north of the shelter. As that area became more distressed, there was a lot of vacant land. So for the past 10 years, every time vacant land adjacent to the shelter became available, I either asked if it was a private owner, I asked them to donate it, or we paid sometimes some tax money. We got some from the land bank, but we own a whole block. And so we'll be able to build a nice shelter. We actually also have a partnership with Oakland University with Coach Campy. He's heading our fundraising committee, and we met yesterday, and they're going to put a nice basketball court there, because that's one of the things that our guests love to do is play basketball. So what we want to do is have things for people to do. We run our shelter year around the clock. We don't discharge people in the daytime to the street. They're there, they can go to the bathroom there. We have food, we have snacks. We try to make it so that they feel comfortable, and the more comfortable they are, the more they trust us. So
That was related to my second question. So for people who are there who aren't outside employed in the world, how do they spend their days at home?
So there's a lot of people they see. So if they have health issues, chances are they're addressing that. And if we have a yard that people can kind of hang out, but we do what's called intensive case management. So almost every day they're touching base with their case manager, and they're being given things to do, like you need to get your vaccination record, because that's part of the proof documents that you need. So we have them on what we call scavenger hunts, because we try to make it fun. And so we are helping people that way. So to give you an example of intensive case management, this was something that happened last week. We had a case manager, Tom, and he was working with a woman who's older. She's on Social Security disability, and I think she's probably in her late 50s. And she ended up finding an apartment, and they're getting ready to lease up, and she has to pay a third of her income for the first month's rent and Social Security deposit. And when they go to do the debit from her bank, she doesn't have any money in there, and even though she had only been paid just probably 24 or 48 hours before. So Tom goes into detective mode. He finds out that she's got an internet boyfriend who has talked her into parting from her money. So he calls Adult Protective Services, but they'll take the report. There's not a whole lot that they can do. But what he does is he goes one step further. So he's working with her the whole time, because he's been working with her to get all her documents, to get her connected with services, to get her connected with money, and then to get her connected, get her whole situation with her banking straightened out. He finds out she gave that money to her boyfriend via Apple Pay. So he calls Apple Pay, and he tells him what happened, and he tells him that she is homeless. Apple Pay restores her money, and she moves in without any kind of hiccup at all. Those are the kinds of things that are happening. And there also are people who volunteer at the shelter to clean, because we don't have any custodial staff, because we can't afford it. Some of them have skills, and some of them have helped us do things like replace the toilet, or troubleshoot some plumbing and things like this. So people jump in because this becomes a community. People have things that they have to do, because our goal is to help them resolve homelessness, not just sit around and wait. And Commissioner Lubes, I really appreciate you asking that question, because most people don't understand that in a homeless shelter, we're competing actually for their time, because they might have an appointment with their primary care, or with their case manager, their mental health case manager. All of those also are in league with us, and they work to try to support that individual and move them forward, and get them to trust again, and get them to dream again.
Thank you.
Any other questions?
Commissioner Powell?
So I just wanted to tell my colleagues, everything this woman said is to her commitment to this project. She has been committed to the project. Everything that she displayed, that is what Hope is doing. And I just hope in the future that the county could step up and we help and invest some way. I don't know what that look like, so my prayers on that. This is a great project for us to be looking to invest in, because again, I want to remind my colleagues, these homeless people come from everywhere. They're not just from Pontiac. Cause I'm tired of people talking about these Pontiac people. No, these individuals come from everywhere. So I was so happy when you said they're doctors, they're this, they're that. Homelessness is everywhere. So if we collectively could support something like this to give more secure space through the year, because you're right, we do this temporary 30-day that the county is trying to help pull it together, and we help during the winter months. This is something great for us to look to future to see if we can help in this capacity. Because again, most of the homeless people are housed though in Pontiac, but this is a Oakland County problem. So thank you for keeping up with this fight, and making sure we help those individuals from that population. So just thank you, because you've been a stand-up person in advocating for Hope Shelters.
Thank you
So
so
thank
much,
you.
Commissioner Powell. I appreciate it. And Commissioner Powell, I would also return the compliment. Whenever I've had an issue and I've had to call her, she jumps right on it. So thank you. I appreciate that. And taking care of people, because a life is a life. Like, you can't put a price tag on a life. And these are people that still have great things in them that they can do.
And one request I have of you, I know you kind of kept it real above. I want to know the numbers. Because again, the county just need to be aware of the numbers. Because if it's something that we can help or invest or find partners, I don't know what that look like. We have multiple ways of trying to, and I was looking at Kyle. We just got multiple ways of trying to figure out things for future to help with this project. So send us the hard question. You was nice today, but I need to know the numbers.
Well, and I can tell you that 50% would be about $900,000 that we would need annually. But that will allow us to pay our people more. That will allow us to expand. When we move into that new building, we are gonna need more staff. We will need custodial staff. We probably will need kitchen staff.
So Ms. Kelly, we are so familiar with what you need with this building. I just want you to send that number so we can try to have these discussions with our colleagues and our executive
Do that,
to
thank you.
just somehow try to support such an entity, be it that this is to serve all of Oakland County.
Thank you.
Thank you.
Appreciate it.
Pass out your cards and.
Yeah, when you're.
Thank you very much.
Thank
I
you.
love hearing about organizations that help make a difference in people's lives. All right, so I need a motion to receive and file the presentation. I have a motion by Commissioner Taylor, support from Commissioner Gershenson. All in favor say aye.
Aye.
Opposed? All right, the information is received and filed. Our next presentation is an update from Alliance of Coalitions. So I think our Sheriff's Department is going to talk about this. I know Julie Brenner, who's the chair of Alliance of Coalitions, wasn't able to be here today. So who am I looking for? Oh,
Ted Miller, yep, and Joel Tomaszewski.
Tomaszewski. Will you come to the front of the table and we finish it?
She's with the Alliance. She's the CEO.
Thank you. Oh, thank you.
Good morning, everybody. Thank you for your time. I'm Lieutenant Chris Miller. This is Sergeant Joel Tomaszewski. We're with the Sheriff's Office Crisis Response Unit. We're partnered with the Alliance of Coalitions. Julie Brenner, who couldn't be here today, we're also partnered with OCHN, wonderful partners. And a shout out to Hope Shelters, who has been an excellent partner to us as well. I mean, just amazing people in there. So we're gonna have a little presentation today, followed by a couple of testimonials at the end. I am probably gonna talk a little fast. Joel's a little bit slower than I am. So if I don't get something out or you don't understand, please just let me know, okay? So there's my contact information. Here's Joel's. So if you need that, we'll pass around some cards. There's also the handouts. It looks like those went around. Okay.
First and foremost, thank the commissioners for allowing us to be here to present today. We're gonna give a presentation on what the Crisis Response Unit is, the successes that we've garnered, what our mission is, as well as looking for sustained funding going forward. Currently, the Crisis Response Unit has been funded primarily through federal grant money. that grant money sunsets on October 1st. Without a sustainable funding source, at least for another year while we seek out other federal money, everything that we've done and the progress that we've made and the people that we've touched will evaporate. With our strategic partners to be able to try to fill that gap, it will be almost impossible.
Okay, so what is the CRU? And I know we've been in front of this board before, but we're really unique in the nation. There are things out there called QRTs, quick response teams. It started with Ernie and Joe out west. And the concept was getting law enforcement out of necessarily just the criminal aspect of substance use disorder and mental health concerns. It was getting them, those folks that are living with those concerns over to treatment and diversion away from that cycling of the criminal aspect. We're a little bit different. We took it a step farther. Not only is it law enforcement, but we partnered with peer support people. Okay, people with lived experience, they're actually partnered with us. We go out to the field, we meet people where they're at, okay? We'll go to their homes, to their workplace. We'll go, we've met people if they were in the jail. We will, if we see people out that are housing challenged, we'll make a contact with them. And the peer support people that we're partnered with help bring the credibility and they help lower that stigma to get that conversation going. This is how we go out in the field. We're not in uniform. We're very low impact. And our goal, like I said, is not the criminal side of things. It's the treatment side of things and the harm reduction side. So, and I apologize looking back at this, but like I said, it was modeled after that quick response model. We've gone one step further and we've had great success. It started in 2022 actually with that federal grant that Joel talked about. Last year, we were able to get a smaller grant that allowed us to bring in an actual clinician from OCHN. So now we've added a co-responder to the mix, which has been a game changer. So we have the ability to deal with people, help people that have a behavioral health concern and most likely a substance use disorder, because we find that's kind of part and parcel. Sometimes they're self-medicating because of that issue. So now it's like a one-stop shop. And the good news is we're countywide. We don't just do this in one particular area. Like Pontiac, we are very heavily involved in Pontiac, sure. But we've been in Ferndale, we've been Southfield. We go wherever the need is and we will partner with anybody that asks because that's what we do.
And the overarching goal of the Crisis Response Unit, we are here to meet people wherever and whenever. At any time of the day or night, if they call to reach out for us, we're there to support them. And truly, our mission as a Crisis Response Unit, while we do have partners of law enforcement and nonprofits, we're not here to enforce. Our mission is to help heal and support people and not arrest and not punish. To be able to build that credibility with the people that we serve, but also to reduce the stigma that still exists over mental health crises, substance use crises, and the homeless crises.
So as Joel said, we built this relationship with our community based on trust and that interaction. There's never one bite at the apple when we're dealing with people that are having either a behavioral health concern or a substance use concern. Sometimes it's several bites. Sometimes it's a year or two. We have clients that are 2-3 years with us. We have one success story well, you'll hear a success story actually, so I won't take up some time with that, but you'll hear a success story here. You'll hear from a judge that of the impact that we've had in the courtroom, because we will even go in, if there's a barrier to treatment that's on the criminal side of things, we'll go and meet with the judges in chambers, out, and try to work this out and try to minimize the best we can the criminal aspect, as long as there is that treatment side involved. So we've had quite a bit of success with that. So intervention, we talked about, like Hope talks about, shelter in that demonstration, that homeless just isn't in one particular place. Substance use, behavioral health, that's exactly the point. This is your brothers, your sisters, your friends, your neighbors that are suffering most likely in silence, right? Because of the stigma involved. We try to meet them where they're at. We get that support to them through peer support, people with lived experience, bring that credibility, bringing that multiple bites at the apple. If they're not ready now, maybe they're ready tomorrow. Maybe they're ready the next day, but we'll be there for them when they are ready. Harm reduction, emphasizing post-crisis intervention. Post-crisis, they're in crisis, whether they're unhoused, whether we get a referral, they're already in crisis. Our goal is we want to intercede and we want to redirect them before it becomes a critical crisis, before it becomes that fatality. And I think you'll see evidence in our presentation that in Oakland County. I think we're a success, and I'd hate to see that end. The trust building, we have clients now that are calling not just our peer support people, but they're calling cops, and they're calling by first name. And it's just an amazing thing to see. It's something, I come from old school way back in the day. I had to learn a new trick several years ago, and it's been really enlightening. I'm really proud of our team. Getting a little choked up, sorry.
And these 4 prongs are the building blocks of how we respond every day. We're not just a reactive unit where we wait for people to call us. We do community outreach on the daily. We do proactive efforts to get people into wellness, to get them into programs. And the last prong in that building trust and that reducing the stigma, that's something that is at its most potent foundation of community policing. The boots on the ground, people that know police officers by their first name and not of the uniform of their rank. The amount of people in my short time being in charge of the unit that specifically say, I never knew that police officers could be like this or would be willing to help do these things for me is truly incredible.
Joel, would a family be able to contact your team directly for help?
Yes,
How do they do that?
We have both a 24/7 crisis line number that rings directly to members both with our strategic partners of the Alliance of Coalitions. But that crisis line also forwards to members of the CRU team. We have QR code technology that we're starting to embrace that people can scan the code and has immediate referrals that they can go through to connect them with those resources as well as members of the crisis response unit and a host of other services that many of the stakeholders in the county provide. Currently, we have 3 main partners here. Not only us members of the Sheriff's Office, where there's a sergeant that acts as the officer in charge, but 2 crisis intervention trained deputies that have the most experience to be able to guide that mental health crisis and offer compassion and have that ability to connect with those people the safest way possible. We also connect with the Alliance of Coalitions, who offer peer support navigators. Those are people with lived experience, people that have faced the depths of addiction and overcame that and achieved their goal of sobriety. Their experience and what they can bring to people on the street is immeasurable. To be able to show that there are success stories and having an actual true peer, somebody that has suffered what they have suffered, to connect with them over coffee, over meetings, over 12-step programs consistently is something that is truly a one-of-its-kind thing in the state of Michigan. And our program, the CRU, is among the first in the nation to offer this. We also have currently a mental health co-responder from the Oakland Community Health Network that acts as a county-wide social worker that can also help bridge the gap and ensure that nobody that is in crisis gets left behind, that they can get connected with whatever services they need, whether it's substance use, whether it's mental health, and the myriad of support avenues that Oakland County offers.
One second. Commissioner, you talked about families, and I just want to touch on that. That's something that we really feel strongly about. We do take a holistic approach because it isn't just, that orbit isn't just around that person, it's around the whole family. And we have one particular family up in the north end of our township that is, this has been a long journey with us, but it's the kids, it's the wife, it's the husband, it's everybody in that orbit, it's even the neighbors, right? Because it just fans out. So we're very aware of that. It's part of what we do. And like Sergeant Tomaszewski said, it's just wonderful that we're able to get out there in a low impact kind of way and get them out there. And most people, and Joel touched on it, we have a lot of robust services in Oakland County. I mean, just a crazy amount of services. The problem is nobody knows what everybody does, even amongst the harm reduction community. So part of what we are doing, and we have some things that we'll talk about in a few minutes that will help continue that on. We act as a conduit for services. We connect those people to the services. You mentioned the homeless count, the unhoused. We just recently helped with that, matter of fact. Phoenix Center, when we had the issue with some of the unhoused in there. Really, our orbit, we haven't even determined what that is. It just keeps growing and growing. So, and we're pretty proud of that as well.
Looking at the statistics from Oakland County, overdose fatalities increased from 2020 and reached the high water mark in 2023, where we had almost 300 overdose fatalities in this county. Through not only just the specific efforts of the crisis response unit, but a holistic response in this county, we brought the overdose fatalities to 40% less in a year, which that 40% beats the national average of overdose fatalities. What we've done, what the Oakland County commissioners, what municipal governments, what the health department and all of these strategic partners have taken a piece of is truly saving people's lives. Any piece of that to remove, there's no telling what the future may hold. These statistics don't just represent numbers. These are actual people. There are fathers, mothers, sisters, and brothers who have been brought back from the brink. We are currently now, year to date, 15% less fatal overdoses than this time last year through those efforts.
Just real quick, for you folks, two of the reversal agents that we use, you've heard of Noxolone, Narcan, right? Opvee is actually nalmefene, and that's piloted in Pontiac, Michigan, and we were the first in the country to pilot that. And it is a very effective reversal agent on the synthetic opioids. So, matter of fact, we are also in the middle of an institutional review involving Wayne State University and Rutgers to help legitimize the efficacy of this reversal medication, and it's gangbusters. I'm here to tell you, generally a one and done dose is reversing some of these incredibly potent opioids out there. So we're very proud of that too. That is another thing that is still moving forward with us as well. As far as these reductions, I'm going to also give credit where credit is due, and that is the secret sauce in all this is the partnerships, okay? The partnerships with OCHN for everything that they do with us, the partnerships with HOPE, the partnerships with our peer support people. So all of this is like this big matrix, this big group of people interacting together that brought that reduction down, or brought that reduction into place, pardon me.
And why CRU matters in this? We don't measure our success in just these numbers. We're not measuring success for what we do and out there every single day in just a sheer number factor. Each of these numbers represents real people. What we can't put a number on are the actual numbers of success stories of people that we have touched, that we have brought to from unhoused to housed status, that we have helped achieve sobriety, that we have given a second chance to. Through our efforts within the Oakland County Sheriff's Office in 2023, we had almost 2,500 mental health calls, and that steadily decreased. That's through the efforts of what the Crisis Response Unit has done, but also with our partners of OCHN and the co-responding social workers. We're not here to, when there's a mental health crisis or a substance use crisis, that holistic, that follow-up, that takes persons calling for emergency assistance off of the number table. They're now our charge, so to speak. When they need something, we contact them, we follow up. It prevents people from being referred back to hospitals to get back out, or ultimately for incarceration, for them to only be released to continue that perpetual cycle. Through our efforts, we've been able to get to people before that they become chronic issues, or where they can't be brought back, or in case of overdoses, if they're fatalities.
Real quick, folks, on this pie chart, I want to point out a couple things. Human trafficking, we've really seen a tie-in, obviously, with behavioral health, substance use disorder, and human trafficking. So we've partnered with that task force for human trafficking. We help identify those people that may be victims of that, and we coordinate. And that has become a focal point. We're tying that in with our gang intelligence unit as well, because again, all these things are part and parcel. It helps identify those victims that are out there where we can hopefully get them steered to those harm reduction services. Rides for Recovery, that's anything that would help that person in their treatment. We've had a particular individual that had she had an injury to her leg. She had to get to the doctor to get stabilized before she could get housing. One of our peer support people who is just, one of our QRT members is just, they're all extremely devoted, but jumped that person in the car, got them to services, and got her stabilized, and we were able to get her into housing. There's just so many different avenues for this. There's other things. We'll coordinate with food banks to get people fed. We will coordinate for housing, community outreach, fentanyl fathers going into the high schools. We have a big program with fentanyl fathers, and we're getting out there and getting that message across. And I'm sad to tell you that no matter what community you're in, we never have a shortage of parents that have lost children to the fentanyl crisis. So that's huge. Court Assist, I already touched on that as well. The other thing I want to touch on is the fact that we do a lot of Narcan training through Alliance, and these Save a Life stations that are out there in Oakland County. They're strategically placed in your communities. They're free, extremely low barrier, and that is something that's, again, a result of a partnership between OCH and Alliance and the Sheriff's Office, getting that out there, keeping it stacked, and making that available. And I think that's made a huge, huge difference, that and the educational side of things, in these number drops that we see.
Throughout Oakland County, that's our jurisdiction. Almost, from the last year and a half of the almost 900 responses that we had, over 50% have been through almost every single community within Oakland County. While the city of Pontiac represents almost 40%, that's not because Pontiac's worse, but that's because we've had a tremendous amount of buy-in from municipal leaders, through our partners at Hope Shelter, through our partners at Common Ground, and through the efforts and training of the law enforcement deputies in the Pontiac substation, to be able to find persons on the street that might need our services and being able to refer them to the crisis response unit to make an impact in those people's lives. Because we respond countywide, we're here to touch anybody from Bloomfield Hills to Southfield to Madison Heights and everywhere in between. We don't care about jurisdictional geographical boundaries, because oftentimes people that are marginalized can sometimes fall through the cracks because of that. And that's where, because of our geographic and countywide response, we can help get to them.
So we talked about a lot of this already. The warm line, 24/7, you are going to talk to a human being if you call us, okay? If that first person in the queue isn't available, it'll kick to the second person, but you will get a response. If it's a critical crisis, that's an immediate response by us, 24 hours a day, 7 days a week. If it's a non-critical, it's within 24 hours. We will have a peer support person or one of our QRT deputies out to speak with that person.
Chris, what's the phone number?
Is it on here? Is it on this? If not, is it on the,
I'm
No.
not sure if it's on the
we will get that to you. It's a
Okay.
1-800 number,
Okay.
or not at 1-800, I'm sorry. Do you guys have the,
I have a card, I have a
Perfect.
couple that I can.
It's not on this either.
okay, my mistake on that, I apologize, but we will get that number to you.
Okay.
Thank you. 24/7 response, we talked about that, bridging the response. That is the conduit that I talked about, making sure that people are aware of the services that are out there and how to get to them, how to access them. The holistic approach, that's your orbit, taking care of those folks in your orbit, and making sure that nobody is left behind or services aren't at least offered. Deflecting to treatment, getting people away from that revolving cycle of going to court, getting court fees and fines, and then just being literally this anvil of money that they can't ever get out of, and it becomes this just hopelessness. So what we do is we're working with judges and we're working with magistrates and we're getting these people deflected to where they need to be for the proper treatment, and providing follow-up. We don't take one bite at the apple. We check on, even if somebody goes through our program, okay? Somebody goes through harm reduction services. We generally, our peer support people, our core people, our deputies, will check up on those people. We have relationships now with some of these people that from just 3 years ago now, our one individual in Florida, I'm thinking, I don't wanna mention his name right now, but he constantly calls with updates on himself. It's amazing. Let's see, this one, the community partnerships we talked about. Hope Shelter is doing great work. Grace Centers, Meridian, just all these people that we've partnered with, and now that's grown into all these different things that we now are getting into. We deal with a special needs registry here in Oakland County. That's gonna help deputies that are responding to somebody who is either on the spectrum or whatever special need there may be. It's a voluntary registry that you could fill out, and it would help identify keywords, hot buttons, things like that, that would help us interact with that person in a non-confrontational way. Overdose fatality review, incredible, meets once a month. We have to piece together, unfortunately, somebody that had a fatality due to an overdose, but we try to look back at those contacts with that person to see where those lapse of services were and how we can counter that, how we can make it better. And we now have a suicide fatality review, because unfortunately all these things, behavioral health concerns, substance uses, or all this is interwoven, right? So we look to see where we can enhance services, add services, what could have been done to avoid that fatality. Some technology. Gelada, that's a case management system that we're in the process of bringing forward. That'll be like a digital directory of services throughout Oakland County. It'll be free to any of those harm reduction agencies out there that would like to join, and it would allow also for digital case management on our side to help make sure nobody falls through the cracks. That's our concern. So that's moving forward. The QR codes that Joel mentioned, that's already in play, and that makes it just easier to interact with us and to capture that data. And rights for recovery we talked about, human trafficking we talked about. LEAD coming forward is that deflection, and we're piloting that again in Pontiac. And that will again steer people from those lower lying misdemeanors that cause that repetitive burden in law enforcement and incarceration, steer them away from that, lift them up, and get them into services.
There's a
Okay, we
phone
talked
number.
about fentanyl fathers. I went ahead in the slides here. Apparently schools, the Narcan training and mental health first aid sessions that are in the community. That is that phone number. I thought it was in here.
Thank you.
Yeah,
as well as a QR.
yes. And so what is our goal here? Joel mentioned that Unfortunately, we're primarily funded through a COSAP grant that has not opened back up, and I'm not sure if and when it will.
How much is that grant?
That grant was for almost $60,000 per year. So we had a 3-year grant on that. We have a secondary grant that's a PAC grant that allowed us to get that clinician in, and that one expires next year. So what we're looking for is a 1-year bridge while we look for sustainable funding.
How much was that for the clinician?
That was, I believe, $250,000, if I remember correctly. But, so that's, our goal here is to continue our mission, moving forward, to expand on our services, continue, growing, in span through Oakland County and getting people to where they need to be. We want to continue with the overdose fatality review. A lot of great initiatives have been identified and implemented since the advent of the overdose fatality review. Gelada I mentioned, and community outreach. And then suicide fatality review is a just recently started thing as well, and I expect great things from that. The overdose follow-up, sustain life-saving outreach, and maintain that downward trend of overdoses. And eventually, our goal, getting away from the slide, I apologize, I hate slides. The main goal here is I envision at some point in the future where we could have a multi-jurisdictional crisis response unit that is all our partners throughout Oakland County, bringing all these resources together and just knock this out. The one other thing is we are also changing the report writing system. I'm working on that with our Captain Schneider. He's been phenomenal. The authority, which used to be Clemis, they've been phenomenal because behavioral health is so underreported. We're now gonna make it mandatory that you are checking for behavioral health and SUD. So that's another thing we're doing.
Hoping for the future is to take the crisis response unit and its model to make it a true fusion center for many other Oakland County departments. To have public health clinicians from the health department respond with us. To be able to take all of these resources that we have, to have strategic partners throughout the community, to have a one-stop shop, to understand what each person and what each agency and department does, to take that back with them, to have a true collaborative model to push our message forward.
Judges?
Hi, I'm Lisa Azadorian, and I'm a judge in the 52nd District Court, 3rd Division in Rochester Hills. I'd like to take a moment to thank the Oakland County Crisis Response Unit for their dedicated efforts to save the lives of our residents. The members of this unit are simply fantastic. They're not standard patrol officers in our community, whose service that I'm also grateful for. Instead, these deputies are specifically trained for immediate crisis intervention. That means every day they go to work, on every shift, they know that they're responding to life or death emergency situations. I cannot imagine the focus and the fortitude that they have when they try to save the lives of the residents of our community. It's hard to believe that this unit has only been operating since 2022. I know that just last year alone, the members of the unit responded to over 1,400 emergency events. And when I say members of the unit, there's only 2 units. There's 2 small units of deputies that cover the entire county to save lives. It's also a sense of relief to have this type of security measure, this necessary layer in our community. Where would we be without the Oakland County Crisis Response Unit? I don't even want to think about that. Their service is invaluable. I know this firsthand. I know when I come to work every day in the courtroom, and I see Lieutenant Miller walk in, or I see Deputy Fagan walk in, I can exhale because I know they've saved a life, and we team together so that I can do my part to help protect and continue this life. Because the people that they deal with have lives worth living and lives worth saving. And because of their efforts, it makes me a better judge. When I see them bring in some of the people that need our help, I know to shift and ask certain types of questions that I wouldn't ask others. I ask about the defendant's immediate past and their present and their immediate needs. And the crisis response unit has all the answers because they are connected to a network of other agencies, and they know if someone needs mental health services, they know where to put the person. If it's more alcohol or substance abuse, they also know where that person needs to be. They work with other agencies, even with other Oakland County departments. So again, I just wanted to thank them for everything they do. I cannot imagine our county without them. They not only service the people with the immediate needs, but these people have family members as well. They have minor children or senior parents, and oftentimes the family needs services as well, especially in the absence of the person who needs the emergency response. So it's not isolated to one person, all right? We're all in this together, and because of the crisis response unit, there are people who are living and they are on their way to living their best lives. Let's all be a part of that to help this invaluable unit keep doing what they do best, which is to protect our great community. God bless. Have a great day.
Hi, I'm Stephanie. I'm 35 years old. I've been working with the Oakland County Crisis Unit for about a year now. Originally, when I started working with them, I was homeless, living in and out of hotels. I slept in a park slide, just actively using and just lost. And they teamed up with me and helped me get into Grace Centers of Hope. I was there for about 8 months, and unfortunately I fell and hurt myself, and I was put out of Grace, still homeless, but the crisis unit was there as soon as I called them and helped me get into another shelter for about a month. But in between there, I had MRIs, a lot of appointments for my knee, and even just like dentist and doctor's appointments. They were there to transport me since I didn't have transportation. And it's been about 2 months now since I've been out of Hope, and I now have my own place, my own car, and working full-time. I have all my children back, so things are really good, and I'm really grateful for this crisis unit because I don't know where I would be without them.
Yes.
Thank you.
Commissioners, ladies and gentlemen, we really appreciate your time. We kind of slid in at the last minute. I know we kind of ran over. Our unit's extremely proud of the accomplishments that we've done so far, but there's still so much more work to do. Every person that we've touched, every life that we've saved, echoes through every single community in Oakland County. Behind these statistics, there are mothers waiting to be reunited with their children. There are unhoused persons desperately seeking for a roof over their head. There are persons standing on the street corner that have been so marginalized, they're just looking for somebody or anybody to give them a second chance. With your support, the Crisis Response Unit, we can continue offering that guiding and compassionate hand. We can promote public health and safety and be that second chance for people. With your backing today, we can help provide other families tomorrow. Thank you.
Thank you. I love that you work with people with mental health and substance abuse, that you meet them whenever and wherever, and that you help and not enforce. So we should be telling you thank you. Commissioner Powell, followed by Commissioner Genzel.
So again, to my colleagues, I've seen firsthand this team go into action in my city. And when they say they help everybody, they help everybody. We in the city had 2 instances where there were 2 tent cities. So like how it is in California, we had a whole row of individuals behind a vacant building building their home in tents and everything that they said as far as they just help, not enforce, lock up, they did just that. And even for people who did not want to be serviced or just walked away, I've seen the aggressiveness of our team to at least still try to help any kind of way with that individual, even if they decide they don't want to, okay? So I am encouraging my colleagues, please, let's listen to everything that they said, and we all know that this was a game changer. We know, especially with the co-responders. Thank you, OCHN, for that partnership. And I know for a fact that my city and Pontiac, born and raised, being able to see this team is a game changer, and them co-responders is a game changer. And I'm just encouraging my colleagues to please support such initiative. I don't know where this money gonna come from, but we need to figure it out. And my last question for you all is funding support requests of us. You said that y'all possibly lost this $460,000 grant. Is that like the federal
big
grant?
Yeah, that's the COSAP grant.
Right, so like, I mean, you all too just gave us a great thing, but I need direct asks. We wanna know direct amounts. What are y'all asking us to assist you all with? We know the 460 and we working and trying to figure that out, but
That's for the 1 full-time equivalent sergeant position and the 2 full-time equivalent deputy 2 positions. The peer recovery associates are provided through us, or to assist us through the nonprofit Alliance of Coalitions. And the co-responder is still covered under a federal grant for another 1.5 years.
okay, so just if we can get that information, so we kind of know overall what you all are asking for, and from a funding perspective, what are we looking at to help fund?
Yeah.
To keep
Commissioner
your
Powell,
unit.
it's on their flyer under funding request.
Oh, so that's the only thing y'all need to move y'all department and keep it rolling?
For 1 year.
We're actively seeking out federal grants with shifts in political direction and other things. A lot of grants for nonprofits and for these initiatives have either been reduced or clawed back.
Okay.
We're actively seeking now for more grant funding, but we don't know the
How it's
sustainability.
gonna go. Okay, good. Okay, well, thank you. Continue doing your work. Y'all know I'm a #1 supporter of you all, and I just wanna tell my colleagues, this is another initiative that I've seen with my own big eyes of what they did, cause I had to go out in the field and help when I used to work at the city. So,
We
yes,
appreciate you.
thank you.
Thank you. Commissioner Ginzel?
Yeah, I
Oh,
think,
yeah, sorry.
no, it's fine. Thanks for coming out. It's really good and, you know, you're doing great work. You're doing God's work out there, right?
Yes.
So, I was just trying to get clarity, but I think I've got it. Your gap's $500,000. You're asking for that to be filled for 1 year while you seek out grants to ultimately replace what you've lost, right? I mean, that's the bottom line.
We're looking for grants. I will submit on that RFI for settlement dollars if I have to. I mean, anything and everything we are looking at. I have a request in for HIDA. I have, funds, just anything and everything.
So you need a bridge because your funding runs out in October.
Correct.
Our ultimate goal is to find some type of sustainable funding to keep this program going as long as possible. But right now, with our funding ending at the end of September, and with the grants that we've applied for, we either haven't heard anything back or how things have. We're asking right now just for a year while we continue seeking other funding, and if maybe this time next year to ask for something different. But we're actively seeking every single avenue to help sustain this outside of the Oakland County budget.
Yeah, the one other thing I would add is if we can, you know, as we think about this, in my mind, if you set up that gap funding, it doesn't mean that you're gonna use it all, cause you could potentially find grants during the year that would offset the amount that we're setting as the cap. So I mean, to me, this like is the upper limit we're talking about.
That would be correct, yes.
Yeah, okay.
Thank you.
Am I allowed to raise my hand?
You're with ACHC?
Yes, I work with.
Well, come to the front of the table.
He is one of our
Introduce
superstar
yourself.
No, not a superstar, God is. I just want to say,
Not.
I've worked in this field a long time, and I've worked with a lot of different police departments on a quick response team.
I know.
I've never seen a team of deputies that are so invested in helping people who suffer from substance abuse like me. It's not just what they do, it's why they do it. I've worked with, like I said, I worked with a lot of law enforcement. They were doing it because their sergeant said they had to do it, or it was something they had to do. My partner, especially, I spend more time with her, but all of them are so, I've never seen this, and I've been working in this field a long time. I too am a person in long-term recovery. I've seen the difference in a short time that I've been here that they have made in my life, just to watch them and give me a different opinion of working with deputies in this field. But the impact that they've had on the city is immeasurable, and the coaches that we have and the team that we have with Alliance and them is something I've never seen before. And I'm not well, I could say I'm an expert because I'm an addict, recovering addict, and I'm also working in the field, but I've never seen anything like this. I don't know if that's gonna help you guys with the decision, but I've never seen deputies so emotionally invested and working as many hours as they do as helping people in the Oakland County community.
Thank you.
Thank you. Very nice.
Thank you.
All right, anything else?
Go ahead.
All right, marvelous presentation. Again, thank you.
Good job, guys.
On our regular agenda item, we move to communications. There are 9 items under communications. 3 are reports, one from Haven, one from Youth Assistance, one from our animal shelter. 3 are grant applications. And 2 are grant acceptances, and the last one is an amendment to the Home Investment Partnership American Rescue Plan Act program from the Department of Housing and Urban Development. Does anybody have any questions under communications? Do you want to prompt those?
I need a motion in a second.
Oh, I need a motion. Motion by Commissioner Powell, support from Commissioner Ginzel. Regarding communications, and while we have a minute also, because our agenda changed in the beginning, you might need to refresh your computer.
Hold it for one refresh and then I can count the vote.
Okay.
Commissioner Gershenson?
I'm sorry.
Oh, for receiving and filing communications.
Sounds good.
You have 5 yeas, 0
No,
nays.
he's all right.
All right, communications is passed. We move on to an emergency management recommendation. It's a request for additional funding for the Oxford High School mass shooting independent after action review report. I have a motion by Commissioner Ginzel, support from Commissioner Taylor, and Tom Hardesty is here to speak to this item.
Good morning, Commissioners. Thank you for your time this morning. Also online is Rob Vaselli, who is the project manager from Guidepost Solutions. So you may recall late last year, the board approved $500,000 for after-action review for the Oxford High School shooting incident. At the time when I was tasked with trying to put together this project, I will admit, trying to find out how much these things cost went from probably a low of $250,000 to $300,000 to several $1 million across the country. So we had requested and you had approved $500,000. We put together a team, went to bid, and Guidepost was awarded this. So they've been working through this, actually about halfway through. They reduced their hourly rates that they had assigned in this because they knew they were eating through hours pretty quickly. But even then, as we're approaching the end and they expect a final report in September, they have gone significantly over the number of hours they had allocated. So between administration, we've been in communication with them over the last couple months and come to a point where we were comfortable requesting from the board an additional $135,000 to cover a cost. They've gone, part of the reason, actually, everyone's been very cooperative with Guidepost in this, but what that also means is it's been a lot of hours and a lot of time spent, tons of data for them to review, and a lot of time spent. So with that, myself or Mr. Vaselli would be open to questions.
Commissioner Gershenson?
Well, I just want to say, having been kept up on this situation a little bit, I know how hard our side worked to justify more funding. So I am very comfortable with the amount that you've settled on.
Thank you.
Anything else? All right, would you prompt the vote, please?
you, 5 yeas, 0 nays.
Motion carries.
Thank
Thank
you,
you.
Commissioners.
Thank you for waiting with us, although we had 2 great presentations that you were able to hear.
I'll speak again for the crisis response team. You know, we have the behavioral threat assessment team that manages things here on campus. They've been a tremendous partner with us on numerous occasions, you know, where sometimes threats are coming from outside, so we've used their services as well.
Yeah, thank you. Our next 4 items are from Health and Human Services. We have different presenters for each item. The first is a grant exception request to the Michigan Department of Health and Human Services for the Emergency Threats Agreement. The second and third are grant acceptances from the Ballmer Group for the Supporting Community Schools with Oakland County's Transition to Success Program, one for Hazel Park and one for Southfield. And the last item is the Housing Trust Fund allocation approval and interlocal agreement with the City of Royal Oak for the acceptance of ARPA funds. So Kate Guzman and team, you're gonna be talking about, we need a motion. A motion by Commissioner Taylor, support from Commissioner Powell. So welcome to our first item under Health and Human Services.
Thank you, good morning, thank you for having us. The first item is our emerging threats funding for fiscal year 26. Last month I presented our amendment 3 to the 25 funding. And if you remember that at all, you might notice there's a dramatic decrease in the emerging threats funding. And so I just wanted to highlight that. The funding that we will receive for fiscal year 26 is $238,606. Dramatic increase from our fiscal year 25 funding, which was originally over $4 million. And so the emerging threats funding is, well, for this current year that we're in now, for fiscal year 25, it included our COVID immunizations grant, the COVID infection prevention grant, regional lab grant, the sewer network, the wastewater monitoring, and so all of that funding has since been cut. So this emerging threats funding is down for this upcoming year to $238,000. We had a really short turnaround. We were just given this allocation on July 11th, and so due to the timing of the board meetings, we're requesting the exemption.
Thank you. Questions or comments regarding this item? All right, we do prompt the vote.
Did you want everything?
Oh, I'm sorry. No, hold on to that one. We have 3 more items to go. Okay, the next 2 are the grant acceptances from the Ballmer Group, and we have Marcy and Sarah regarding this. Okay, what do you want to say about these items?
Well, we came before you as we were applying with Ballmer to receive the funding, and we are so excited that we received official award of these funds. Nothing changed between our application and their award of the funds, so we are looking for your support to accept $4,668,000 and change to expand our community health worker team and mental health supports in Southfield and Hazel Park school districts. The grant is for three years, so it's a sizable long-term for a grant investment in this work. And I do just want to also point out that there's a little bit of a carve-out in our award, which will allow us to endow the Dr. Calandra Green Scholarship that Oakland University holds for us at $75,000, which will guarantee, assuming that the numbers work out, 3 scholarships every year in her honor.
Thank
from
you.
Ballmer's generosity. So,
Great.
all good news.
Thank you. Any questions regarding those 2 items? Okay, the last item under Health and Human Services is the interlocal agreement with the City of Royal Oak for the ARPA monies. And I know Steve introduced himself at public comment if there are any questions also. So.
I have a presentation, but I'll try to go
Yes.
quick. I know we have budget hearings. And but we're very proud of this project. I've been working with Stephen and Lockwood for a while and the City of Royal Oak to get this project to where it's been over a year of planning and going through their approvals and everything. But I'll just say from the beginning, just hearing from Hope Shelter, I've been working with Elizabeth on funding the new shelter, and then the CRU team. This is kind of like the 3rd phase of the ecosystem where you go from the crisis response to the shelter. And what we have here, the 3rd Street Lofts project in downtown Royal Oak, is just a mixed income housing development that'll have affordable units at 50% area median income up to 120% area median income. And it's in a spot where you have access to literally every possible service and amenities, jobs, retail. And so that's like, I've never, like, we're very excited to have like this walkable TOD mixed income housing development in Royal Oak. So one factor of it, and here's another screenshot. Like I said, I'll try to go quickly. But it'll have 59 units, 44 one bedroom, 15 two bedrooms. 4 of the units will be at 50% AMI. I'll show you what those rents are in the next slide. 27 has 60% AMI, and then the other half are essentially 120% AMI. And that's effectively market rate, but it does prevent that from the developer from jacking up rents super high because it's still based on a HUD income calculation. So this gives us a broad range of incomes for everybody to live together, work together, and be able to live there. It's a $25 million total development cost. The Housing Trust Fund Board, almost a year ago today, approved a resolution to fund the project in an amount not to exceed $5 million during that time. And since then, the City of Royal Oak has expired or recycled ARPA dollars, SLRF funds, similar to what funded the Housing Trust Fund. And they're actually contributing $1.9 million of their funds to this project, which this is all in the form of a repayable loan. So once this loan is paid off, it is a long-term loan, it'll take a while, but we'll still be able to keep all of these funds, and their funds can be reinvested in Royal Oak per the local agreement that I think is in your packet, and then we'll use our funds wherever we need to throughout the county. The City of Royal Oak also approved a payment in lieu of taxes and considerable zoning changes to make sure that this project can fit on that site, because as you saw, it was right next to the courts, the municipal complex, and the farmers market. Like I said, walkable to downtown amenities, 10 minutes to the smart Royal Oak Transit Center, making it what I consider a true transit-oriented development. And another factor is that there's only 3 income restricted properties in Royal Oak per the HUD community planning and development maps. For too long, like we've concentrated a lot of our affordable housing in certain parts of the county. So with this actually gets us to put something in a lower poverty area, but still be able to provide housing at rents like this. So the current market rents per the market study that was provided as part of the application, Royal Oak is crazy. It's almost $2,200 for this is brand new housing, like downtown, like the new stuff that you see on Main Street, all the way up to 4,000, whatever. That's I don't know. It is what it is. But then you see the 4 units at 50% AMI rents. That's under $1,000 for a 1-bedroom and just over $1,000 for a 2-bedroom. The 60% units are just over that at $1,136 and $1,363 for 2 bedrooms. And then the 120 AMI rents, it is an actual need for them to recruit and recruit businesses to be able to have housing that young professionals want to live as they're doing their business recruitment. So it's very important that as part of the pilot that we provided the 120% unit AMI units, because when we first received it, it was all market rate, but this allowed us to extend the pilot to all of the rents where the developer will end up paying is it 4 or 2%? 2. It's a 2% pilot, so all of the revenues that they get from the rents, those 2% go back to cover the costs of providing municipal services for this project to the City of Royal Oak. And that's a view. If you're familiar with the corner at 3rd and Troy at Centennial Commons, that's what the view will look like. And I'm happy to say I am a resident of Royal Oak, so getting to walk by that and see that, I'm very pumped to say yes in my backyard. Okay, this is my favorite slide. You've seen it all before. I won't belabor the cost, but this is who we're actually serving here from 30%, or I guess we're at 50% here, all the way up to 120. Those are the incomes. These are the jobs. Oakland County doesn't run without these jobs, so we need to make sure that we continue to provide affordable housing. Here's the next all the way up to the 75,000, which is kind of around that for a family of 4, the 80% range. And then just to give you an update on what we've done as a board, it's about just over almost 2 years ago, in 23 months, the Housing Trust Fund, we have 9 mixed income developments approved and at various stages of under construction. That represents 649 units, 520 of those are workforce and affordable housing from 30 to 120% AMI. That investment of $23 million has resulted in over $180 million of housing investment throughout the county.
Right.
And then, and on top of that, because we don't bring, when we apply for our home and CDBG funds through this committee, we also allocate funds for rental housing. And since September 2023, we've also approved approximately $6.4 million in home and CDBG funds for an additional investment of $103 million into housing. So all told, that's about 1,060 units, 931 of them affordable, $30 million approximately, it might be a little bit more than that, resulting in $283 million of total investment in affordable housing. So this will be the last of our ARPA dollars going towards this project, but we are working with foundations, nonprofits, and then all the people that fund these projects. We'll be hitting up the financial institutions that partner with us to raise money and then also look at other financing and funding streams. So with that, if there's any questions, just let me know.
Commissioner Powell?
So with the federal cuts of the, I think like the big bill, I was reading on something, did they have anything in there that affected your department as far as the CDBG and home funds? Was anything affected? And if you don't know now, that's fine. Just know it's a question, you can answer it later for me.
There is a current budget draft that has removed home investment partnership funds from that. CDBG remains, but home is currently one of the drafts that we've seen didn't have home investment partnerships fund, and that covers about $2.4 million of our annual budget. So it's huge. I mean, this is getting home investment partnerships from the state of Michigan. So a lot of our projects use all of these different sources of funds. So it'd be detrimental to all different types, like our home repair program, any sort of rental system. It does so many different things. So it'd be tough to continue to do affordable housing without that budget and revenue stream. Because I think a lot of our seniors that we serve with the home investment partnership home repair program, you would see a noticeable cut.
So have we got any updates from federal that that's gonna happen? Cause I read something, I just didn't.
I don't know where it stands. The last I saw is it came out of a committee, I'll be honest, I had never heard before, so I don't know how far down it is, so.
You good, I'll touch base with y'all later.
Yeah.
Okay, thank you.
Commissioner Taylor?
Yeah, thank you. I just had a real quick question. I don't remember seeing when I was looking through here parking, and is the parking for one car or two per unit? I don't remember seeing anything in there when I was.
Is there 63 spots?
Yeah, exactly. So 63 spots in a garage underneath.
Underneath?
Yep.
Okay, all right. Thank you. That was my question. Thank you.
It's Royal Oak, it's parking.
No. That's the other reason I'm
Yeah,
asking,
exactly.
it's parking nowhere.
No. But they're changing it supposedly.
Okay, thank you.
I know, I love the idea of adding affordable units to a community. In a neighboring community, tonight on the council agenda is selling their 15-unit senior.
Oh, that's tonight?
Yes.
Okay.
Well, to put it up for vote for
Okay.
November, I know. So.
I
it's one of my
just,
battles.
they weren't able to make it, but I'll just say the commitment that the city of Royal Oak has had to getting this project done. People were more upset about a gas station than they were about affordable housing, so I'll take that all day. That was nice, so I was happy with that, but they've been a pleasure to work with, and the interlocal agreement will be great. That's already been negotiated between our corporation council and their council.
Thank you. Anything else? All right, would you prompt the vote on the Health and Human Services items?
You have 5 yeas, 0 nays.
Motion carries. Thank you, everybody. We're moving to our public service recommendation. It's the Animal Shelter and Pet Adoption Center gift acceptance from the John Duncan Sparham Trust. And Bob, you're almost done. I have a motion by Commissioner Ginzel, support from Commissioner Taylor. Welcome, thank you for staying with us.
Well, welcome, thank you. Good morning, Commissioners. It's my privilege to be here this morning, and it is still morning, asking for your permission to accept a very generous gift from a now deceased young man, John and Duncan Sparham. Mr. Sparham was a longtime resident of Waterford Township, and he was an animal lover. And in particular, he loved cats. He used to come to the shelter and visit with the cats on a very regular basis. When he passed away a couple of years ago, he left our shelter over $50,000. I came to you in '24 and you approved that gift at that time. Today, the last of Mr. Sparham's estate is being dispersed, and there's another $16,000 slated for the shelter to be put into our legacy fund, and I'm asking for your permission to accept that gift.
It is a marvelous gift that someone is willing to spend their money.
Commissioner, it astounds me at how many people die and leave us large sums of money in their wills and estates. It's very heartening. And now when I see people come into the shelter and just gravitate toward the animal cat room or even just walking down the dog roads, they're not there to adopt, they're just there to visit. I think to myself, you know, these are people that they love these animals so much, and maybe for a variety of reasons they can't adopt one themselves, but they do come and visit.
Right, thank you. Any other questions or comments? Commissioner
I always
Christensen?
think this is a trick question when they're asking us to approve receipt of money, but happy to do it.
So what was the question?
No,
No.
we're good.
Okay, just, would you prompt the vote, please?
You have 5 yeas, 0 nays.
Motion carries, thank you.
Thank you all so much. I'll see you in about an hour.
All right. We have 2 items from the Sheriff's Office. The first is a grant acceptance from the Office of National Drug Control Policy for the 2025 High Intensity Drug Trafficking Area Program. And the second is a donation acceptance for one support canine dog. So welcome to our Under Sheriff and Gay. I have a motion by Commissioner Genzel, support from Commissioner Powell.
Good morning.
Morning.
Afternoon.
So the first one is our annual grant acceptance from HIDA. So it's $132,300 this year, which breaks down to about $5,650 of reimbursement per officer. And then I think in your packet, all of our partner teams are listed with those municipalities. The next one is another canine from donation from Mission Oakland. We do not have the puppy yet. I don't think it's ready, and obviously we wanted to come to you beforehand and ask for permission to do the donation once the puppy becomes available, but it will be assigned to a school resource officer in the city of Pontiac.
Thank you. Any questions regarding either of these items? All right, would you prompt the vote, please?
Mine ain't come up, but I'm a yes.
You have 5 yeas, 0 nays.
Motion carries. Thank you for waiting with us.
Okay, I was gonna say 6 yeas. They didn't die.
All right, we've arrived at our public comment. Is there anyone from the public wishing to comment on any item today, this afternoon? All right, public comment is closed. There is no other business to come before this committee, so we are adjourned at 12:04 p.m. Thank you.